I should like to start by marking two very important dates that I think are relevant to this debate. The first is May 5th, International Day of the Midwife, and the second is May 12th, International Nurses Day. These dates are important occasions for members in this place to note, not simply because many of these incredible people are servants of the New South Wales public, however, let's face it, that would be enough, but because this bill is, in all its substance, concerned with them and their occupation. In achieving its two major objectives, one, expanding the scope of practice for nurse practitioners and endorsed midwives to prescribe MS two-step medication up to 9 weeks gestation, and two, requiring an annual report be presented to Parliament detailing the provision of these services, this bill changes the way nurses and midwives can serve our communities. And that is why I've chosen to elevate them specifically when considering my position on this bill. Because while parliamentarians like us may lead, in the end, it's the people that deliver. And we should ensure they can do so in the most informed way possible that improves the efficiency and functionality of the overall health system and avoids the inadvertent restriction in practice to what is already legal in principle. In its current form, the bill does that. What it doesn't do is change the legal status of abortion. Neither does it introduce a new method of performing an abortion, nor can one obtain an abortion any earlier or later than usual, and certainly nobody's autonomy to choose whether to participate in an abortion will be infringed as a result of this bill. Preserving these outcomes has been a strong focus for some in the community, and I hope the amended bill brings some comfort that their major reservations have been addressed. I particularly want to acknowledge the respectful and considered way that those in Ryde who may remain concerned, including the many others with strong views in support of the bill, engaged with my office and I in advance of this vote. It has been another reminder of the extraordinary privilege to live in this country, where even on issues that test the resolve of a society, the vast majority emerge respectful, even if in disagreement. Of course, not all will adopt that approach. The apathetic retreat and the fringes divide. Both extremes pose a danger, but neither can prevail. Decisions are made by those who turn up, and while the apathetic miss out, so too do the fringes, because exclusion is the hallmark of the fringe, and without the inclusion of partners in progress, real and lasting change is impossible. That change has to come from the centre, which I believe is consistent with the essence of what is achieved in this bill. The centre is the realm of most citizens, and particularly those in Ryde. It is also the place from where health policy should be made, and is why I will be supporting the bill as amended in the other place. Before I speak in more detail about the bill, I want to reflect on its evolution. Those familiar with the initial proposal recall it sought to expand the availability of abortion services throughout the state to ensure they were located within a reasonable distance of people's homes. Proponents argued that this would have ensured better and more equitable access, but the measures presents some fairly obvious challenges in practice, particularly in remote communities. It would have required conscientious objectors to refer patients to a service provider that would have delivered the abortion service in their place. Proponents of this measure believe that the personal views of a medical practitioner should not impede one's right to a legitimate medical service. Others argued it placed the objector in a morally compromised position where they would be required not to perform a termination, but participate nonetheless in a patient's journey of obtaining one. Finally, it would have removed mandatory notification requirements which were proposed in order to reduce the administrative burden on providing termination services. While removing practical burdens to healthcare access is logical, it is similarly logical to believe the benefits of more and greater transparency of data outweigh this minor inconvenience. All three components, location of services, requirement to refer, and abolition of reporting, have been removed. All three components, but particularly the first two, were the overwhelming cause of concern among my constituents, and I have been pleased to see even some of the staunchest opponents of this bill concede that it now takes a more reasonable form. It may not be one that they expressly support, but it is a vivid reminder of the workings of our democracy, that reason and compromise can prevail. I'm also comforted knowing those with ardent objections to these changes retain the absolute right not to engage with the services. As a society, we owe it to them to always respect that choice and empower them to pursue alternative paths in keeping with their own preference and conscience. Which is why it is also right and proper that this matter be dealt with via a conscience vote. That was the basis upon which previous reforms to abortion have been introduced, and is respectful to the variously strong views held across communities and represented in this place. And on that note, it is worthwhile to acknowledge that there are members in this place, myself included, who have taken positions that run contrary to the views of their closest colleagues. I want to thank them for the respect and decency shown. Of course, as I have alluded to earlier, the most contentious and conscience-oriented components of the bill that raise concerns for many of my constituents have now been removed, which is why I approach the bill as it stands, through a practical health, staffing and policy lens. It is objectively right to make policy decisions with the benefit of contemporary and transparent data. The requirement to report to Parliament will help all policymakers, regardless of opinion on the merits of pregnancy terminations, to inform themselves more comprehensively on the matter. If there are problems, they are more likely to be uncovered and addressed as a result of the reporting requirements contained in this bill. This is particularly important for giving confidence to our hard-working nurses, midwives and doctors, who we know are already under pressure in a stretched and challenging environment. Which brings me back to the original point on this debate. In a week where we are giving thanks to healthcare professionals, the best gift that we could give would be to tackle head-on the challenges they face in the role. It hasn't occupied the headlines during this debate, but for me, this is one of the most salient points for why the bill should be supported. Today, notwithstanding the Therapeutic Goods Administration's recommendation in 2023, New South Wales restricts prescription capabilities for MS two-step to doctors. As a state, we are actually out of step with most of the country and have passed enabling legislation to abide by their recommendation. However, leadership requires making the right decision for your circumstance, and the argument that others are doing something is not justification alone to follow suit, which is why I think it is important to advance the argument for a more efficient healthcare system that utilises its best resources, its people, to the fullest. I've taken some time to understand the amount of work that goes into becoming a qualified nurse practitioner or an endorsed midwife. They are exceptionally qualified people, and certainly overqualified to prescribe an oral medication. So why shouldn't they be able to ease the burden on doctors, if needed, in order to improve the efficiency of the overall system? Such an approach is consistent with a multidisciplinary, team-based model of care, which in the case of pregnancy and terminations already involves nurses and midwives. It is unclear to me why doctors should be treated in isolation for the purposes of this one component of a termination journey. This is just one very small example of a tweak in the system that can make it work a little more smoothly, and is a wise policy approach that could be applied to other avoidable bottlenecks. Not only can it ensure quicker and better services for patients, but it reduces the inevitable costs associated with delayed or cumbersome processes. This is about facing government outwards and putting it at the service of the people, not of process. That should be the basis of all legislation in this place and what our communities expect. Ultimately, this bill is for those who choose to use it and the benefit of a workforce already working so hard for the public good. On both accounts, as I have articulated, it moves the needle in the right direction and is therefore worthy of my commendation to this House.